Well, hello everyone and welcome. I'll give everybody a few minutes to get in and get comfortable, make sure that your screen is working and your audio is working and so forth. If you have any issues, let me know. You can send me a chat or in the QA and we'll try to figure out what's happening. So without further ado, I'm gonna go ahead and say hello everyone and welcome. Um, Welcome to FIC. What's all the stress with Kara Burns? And thank you for joining us. And thank you to our sponsor, Veticus, the Western Veterinary Conference, for sponsoring this webinar. And just a quick reminder, I always have to do this. You can help support the mission of Every Cat Health Foundation by donating to us at www.everycat.org. And I will drop that into the chat as we go along. A little bit of quick housekeeping. This webinar is RACE approved for 1 CE credit, and there will be information on how to obtain your certificate at the end of the presentation. So stick around for that. And time permitting, we will have some time for questions. However, please drop your questions in the Q&A feature, and we'll come back to those at the end. So without further ado, so she has enough time to cover everything that she needs to cover, I'm going to go ahead and introduce our speaker. For those of you that, I don't know, maybe live under a rock or something. Kara Burns is a licensed veterinary technician with a master's degree in physiology and a master's degree in counseling psychology. Kara is the founder and past president of the Academy of Veterinary Nutrition Technicians. She serves as Director of Veterinary Nurse Development for Wellhaven Pet Health and is the Editor-in-Chief of Today's Veterinary Nurse. She's also an independent nutritional and well-being consultant and teaches nutrition courses around the world. Among her many accomplishments, she is the Technician Education Manager for Western Veterinary Conference and is currently the President-elect of Every Cat Health Foundation. She is the past president of NAVTA, the National Association of Veterinary Technicians in America, and is the former treasurer and board member of Pride Veterinary Medical Community. She was the first technician elected to the board of the American Association of Feline Practitioners, now called Feline BMA, and is the first technician to be the president of the Pet Nutrition Alliance. A member of many national, international, and state associations, she has authored many articles, textbooks, and textbook chapters, and is an internationally invited speaker, focusing on topics of nutrition, leadership, and very importantly, technician utilization. Ms. Burns was recently named the Bridge Club's 2024 Veterinary Industry Icon Award recipient, and she is the first technician to be recognized as so. She was also granted an honorary veterinary technician specialty in internal medicine in 2011 and an honorary veterinary technician specialty in dentistry in 2012. Without further ado, Kara Burns.
Wonderful. Thank you so much, Virginia. And thank you everyone for being here and for your interest in FIC. What's all the stress? Presented by the Every Cat Health Foundation. I am so grateful that you guys are here with me today. Good afternoon, good morning, depending on where you are joining me from. Typically I will say, typically I am on camera because I like to interact with everyone. Even though I can't see you, you can see me being a goofball. But recent eye surgery, I don't think you guys want to see that. I don't, want you to see a big old patch. So you're just going to get me talking to you today. So I truly hope that is okay with everyone. And again, thank you for being here. And I also want to thank our sponsor, Veticus Group, which puts on the Western Veterinary Conference annual conference every year. And it's one of the largest and longest running veterinary conferences in the country, hosted in the entertainment capital of the world, Las Vegas. So there's tons of educational opportunities, lots and lots of feline CE. So I did put the website up there. So, take a look. And again, on behalf of Every Cat and myself, Kara, I thank them for sponsoring this session. So let's get into feline idiopathic cystitis. And first, let's talk about inappropriate elimination. We know that inappropriate elimination is the most common behavioral problem for which owners are bringing their cats into the veterinary hospital. But unfortunately, we also know that it is a very common reason why, some pet owners end up relinquishing their cats to shelters. So it has a huge, huge impact. Feline lower urinary tract disease can have a big impact on that pet family bond, especially for the reason, the major reason we just spoke of, if it does lead to relinquishment to a shelter. But also think about feline lower urinary tract diseases and, the pain for the whole family. Yes, absolutely for the cat, but also how does that impact that human-animal bond? So if I were to ask you, what are some of the causes of lower urinary tract disease or lower urinary tract syndrome? Well, I think we would determine that uroliths are, roughly 20%. So crystals, that is the more common term. Plugs, right? Those are about 15%. There's always the inevitable miscellaneous category, right? Where we have anatomical defects, perhaps cancers. But if you look at this pie graph, we see 60% is FIC. And what is FIC? Feline idiopathic cystitis. So what does that mean? Well, when the condition has no truly identifiable cause, then we know that to be feline idiopathic cystitis. And it's the exclusionary diagnosis made once all the common or known causes of the clinical signs of abnormal urination have been eliminated. And of course, this is being done, yes, with the help of us as veterinary technicians and veterinary nurses, but this diagnosis is made by our veterinarians. And, some studies suggest the condition is similar to interstitial cystitis in humans, especially human females. But I have known human males as well to have interstitial cystitis. It's most common in young to middle-aged cats. And it's also known as a condition called Pandora syndrome, because the underlying causes for the condition may reflect abnormalities in many organ systems, including the nervous system, and the effects of environmental stressors. So cats often suffer waxing and waning of clinical signs in response to things that affect the central stress response system. We're going to talk a lot more about that central nervous system or central stress response system as it relates to feline idiopathic cystitis. But first, I do want to say, to ask, when you take your cat into a veterinary hospital, or if you are working in a veterinary hospital, what does your hospital recommend to help manage FLUTD and in this instance, FIC? I'm sure many of these on the slide are what you have answered, right? And so, yeah, there's quite a few things here. I am going to stick to environmental enrichment. We're going to talk about some nutrition and specific nutrients, omega-3 fatty acids, type A packs, urinary foods. Okay, so yes, I understand there's a lot more options available through our veterinary hospitals, and specifically some of these prescribed by our veterinarians. But I'm going to focus on some specific ones. Obviously, you heard I am a nutrition technician, so nutrition is what I live and breathe every day. But first of all, truly, no matter what you do or don't do, acute FIC episodes last anywhere from 3 to 7 days. And to date, no treatment has been shown in a controlled study to decrease recurrence or duration of FIC episodes. So then what is the goal of therapy? Well, we obviously want to make the cat more comfortable during an episode, but we want to absolutely decrease the number of painful days, right? So this is our goal of FIC therapy, to decrease the number of painful days. So we saw 3 to 7 days. We don't want our cats to be in pain for 3 to 7 days. So we want to help manage that, to help decrease the number of those painful days. So key nutritional factors. If we're looking at FLUTD, so feline lower urinary tract disease as a whole, then we want to think about controlled levels of magnesium, calcium, phosphorus, and oxalate, because these are building blocks of crystals and uroliths. So we want to reduce these building blocks. We want to add citrate, because citrate is a crystal and urolith inhibitor. And enhanced vitamin B6 is going to help decrease oxalate formation and excretion. Excuse me. We also want an antioxidant bundle. Vitamin E and beta carotene, those are going to help counteract oxidative stress and generate an environment unfavorable for the development of uroliths. One of my particular favorites, omega-3 fatty acids, they help to break the inflammatory cycle. And we know FLUTD and FIC to be an inflammatory process and an inflammatory cycle. So we also want to take a closer look at, and throughout the rest of this, we're going to take a closer look at some nutrients that will specifically help FIC. And so we always hear, oh, cats hate water, right? Water is the absolute most important nutrient for us, cats, dogs, horses. But the water needs of cats differ from dogs because of their ancestors' adaptation to environmental extremes. So, domestic cats have descended from desert dwelling cats. My accent came out there, so sorry. And cats are actually able to survive on less water than dogs, and actually may fail to increase water intake at minor levels of dehydration, up to 4% of their body weight. And so highly concentrated urine then is formed in cats to compensate for reduced water intake. This strong concentrating ability, in addition to a weak thirst drive, may result in highly saturated urine. Sorry about that. I also have a cold, and I'm trying not to cough, so my apologies. Okay, so we also know that a highly saturated urine increases the risk of crystalluria or urolithiasis. So what should be a cat's water intake? Well, we want our owners to be focusing on ensuring that their cats are drinking. If we wanted to give it a number, 1 ml of water per every kcal of metabolizable energy. And, as I said, we have heard forever that, oh, cats hate water. Well, I think this guy would disagree. And I won't play this whole thing, but you can see, yes, it's an older video. And there's tons of these on YouTube, right? But this guy is thoroughly enjoying his water. So yes, we could play that for quite some time, but I won't. You guys get the point. Cats really don't hate water. And here, when we're talking to owners about water and increasing water intake, let's talk about, different types of bowls or different ways to get water into our cats. Fountains. Cats really don't like stagnant water. So, here we have cat fountains. We know they exist. We know that they are for sale. Many of us have them, right? My own Persian loves fountains. But at the same time, I have a snowshoe that loves to empty water out of the dishes, out of the fountains. So, so I have to carefully monitor what is what is being placed in, or really the amount that's being placed in the water bowl. But again, most cats do like water fountains. Maybe putting some toys in. That one cat that I mentioned to you that likes to put most of the water on the ground, he likes to put his paws in the water and lick it off of his paws. We've all heard stories of cats that just love water from the faucet. And then, I am going to talk a little bit about the size of bowls, but let's start thinking outside the box, either in providing or recommending different water bowls for our patients. So when I said I'm going to talk a little bit more about it, I want us to think about whisker fatigue. And remember, stress plays a big part in FIC. And so with whisker fatigue, the whiskers, it's not really a disease or caused by like truly any type of illness, but it manifests primarily with the repeated daily contact of the whiskers with food and water bowls. So a cat who is stressed is not happy. We know that. And then if that cat avoids eating and drinking, she might become malnourished and or dehydrated. And so let's think of some whisker-friendly dishes for cats. And yes, this also includes our cat water bowls. So kind of what you see here, right? This one is higher. Cats like, they're crouch eaters, so they like to be able to see while they're eating. It again decreases stress. And so here we have it. I like these, but I would actually have them a little bit wider and flatter. Again, to prevent those whiskers from constantly hitting the side of the, in quotes, bowl. Something along the lines of a flatter, again, wider dish, such as this one. And then also non-conventional bowls, right? We are trying, as I keep saying, to decrease the amount of stress. Decreased stress will help manage our FIC cats. So maybe we don't use a bowl at all. Maybe we use some feeding puzzles. And, they don't have to be store-bought or expensive. They can be an egg carton with the food in it. an ice cube tray, again, with the kibble in it. Something as simple as a water bottle with a hole cut out for the kibbles as the cat moves it to fall out of. This also helps cognitive stimulation. So it helps to prevent boredom. It helps to prevent whisker fatigue, and it gets the cat moving. We can also, add an obstacle, right? Again, we can find store-bought puzzle feeders that are, inexpensive to very expensive. Or we can do some, at home, getting a muffin tin, putting some kibble in it and covering that so the cat has to uncover it to get the food. This is all part of environmental enrichment. And environmental enrichment is really providing opportunities for play, for providing enjoyable activities, scratching posts, toys, water fountains, feeding puzzles. Environmental enrichment also involves places to hide or rest, such as kitty condos, right? And again, food and water dishes, which is what we've been talking about. And we also have to talk about where these food and water dishes are, and are they being cleaned? And I know everyone on this call, we talk about it, or if we are owners, we know to clean, but I think we have to share with our colleagues that yes, food and water dishes, location is important, cleanliness is important. There we go. So when I was talking about kitty condos, I'm sure you guys know them as well as I do, but it's these, scratching posts, opportunities to go up high, or maybe to hide and get away for a little bit, hide behind the stairs here. Interactive toys, cognitive stimulating toys, right? All of these help with the management of stress in cats. And then getting back to litter boxes, right? What is the proper number? If I have 2 cats, how many litter boxes should I have? I'm sure you guys all answered 3, right? The 1+1 guideline. So there should be 1 litter box for every cat plus 1. And we really do also need to think of the characteristics of the litter box. It should be 1.5 times the length of the cat. Should have lower sides if we have older cats or if we are talking to owners of senior cats. 90% of cats over the age of 12 have osteoarthritis. So if they start urinating outside the litter box, it may not be FLUTD, but of course our veterinarians are going to take a look at that and diagnose what truly is going on. But if it is osteoarthritis, we need to educate owners to get the proper litter box size and sides for our older cats. And we should also educate them on locating that litter box where the cat can escape, right? If we look at this one, right? Many owners like these because they look pleasant for a litter box, right? No one wants to really look at a litter box, but here we have a nice wicker litter box in the corner. And this cat right now looks like an only cat. But we know if there are other cats or other species of pets, right? My French bulldog would be right here waiting for the cat to come out. And so that can create stress. So these are not often what owners like to see is not often the best litter box for our patients. And covered litter boxes are not ideal. It traps odors, and, some of our owners, if they don't see what's going on in there, then out of sight, out of mind, and they might not, clean it as often as it needs to be. In addition, most cats prefer litter that is clumping and unscented. And this is true. There are many veterinary behaviors out there that have done this research. And who likes litter that is scented? Owners, right? Us. We don't want to smell anything, but imagine being that close to the scent, and having that strong perfume. So yeah, most cats prefer litter that is unscented. And then litter box maintenance. And yes, I do have to talk about this because of, here and again, I'm sure everyone on this call is not having their litter boxes look like this. But we need to talk to our cat owners and our colleagues that we cannot, this is just, would you want to go in this? I mean, there's nowhere left to go in these litter boxes. So yes, cleanliness is important. So again, litter box maintenance as part of environmental enrichment is huge. And studies do show that environmental enrichment in cats with FIC does help to manage that FIC. In fact, in this one article, significant reductions in lower urinary tract signs, fearfulness, and nervousness was observed in this study. And fearfulness and nervousness are two anxiety producing signs. Let me say this right. Cats show anxiety through fearfulness and nervousness. And we'll talk a little bit more about that in just a second. But I cannot mention enough, I cannot reinforce enough that environmental enrichment plays a huge role in the management of cats with idiopathic cystitis. There are a number of resources out there. This one I wanted to just give to you. This was started by actually the individual who was also the first author on that study I just showed, Dr. Dr. Tony Buffington, who is a board certified veterinary nutritionist as well as a feline expert. And this was started at the Ohio State University when he was there. And it really is a wonderful resource for veterinarians and veterinary healthcare teams, as well as for pet owners. So veterinary healthcare team members out there, if your owners are looking for a resource, here's one great one to offer them. And remember, we're trying to, our goal is fewer painful episodes, because fewer painful episodes from the cat's point of view means less of this, right? Less hanging out in the litter box and more hanging out with their owner and strengthening that human-animal bond. So far we've talked about a little bit about nutrition and the key nutrient of water. We've talked about environmental enrichment. We're going to talk about a couple other nutrients now that aid in managing stress in our FIC cats. So it's easy, right, for us to recognize that this cat is stressed, right? There's no question there. And typical signs of flight, fight, or freeze response. But what about this cat? This cat on the right is most likely suffering from the effects of chronic stress and is at risk for FIC. You can see that this cat is hiding, right? Yes, this one, we know this cat is stressed. But owners, right? Many times the signs are subtle, such as this one, and may go unnoticed by pet owners. So what are some of the risk factors consistent with stress? Well, this is what I was trying to explain earlier. So nervousness and fearfulness, they hide from visitors, right? Think about, people that come over the house, especially this time of year, right? Holiday gatherings. This is a very stressful time of year for our cats because they like to hide from visitors. Cats are also stressed when we move or we change houses, right? Say we move to a different house. It doesn't even have to be that substantial. If we move furniture within the house, cats are used to their getting their consistency. They do not want any changes. So if we move furniture around, that then becomes stressful for the cat. Their consistency is gone. They have to learn a new routine, if you will. And so what are some of the common anxiety triggers in cats? People, again, so, people coming to the door, people that they don't know, even people that they do know. If they are, coming over and they're, maybe being loud, acting a little different than the cat is used to, that is an anxiety trigger. Sounds, right? Mostly sudden noises were most common trigger for 35% of cats. So think of sudden noises, sneezing, loud talking, loud music, thunderstorms. So thunderstorm phobia is not just for dogs. Um, the doorbell or the phone ringing, all are sounds that can trigger anxiety in our cats. And then other animals, right? Familiar cats, yes. Dogs, strange cats, right? If they see strange animals outside, then that is also a cause for anxiety in the cat. And so let's look at what is happening when we look at an environmental stressor and how this ends up affecting cats with FIC. So, when the cat with FIC perceives environmental stress, then the stress response system is stimulated. This enhances activity in the sympathetic nervous system and increases outflow down the spinal cord to the urinary bladder. In normal cats, this response is regulated or dampened by activity of the hypothalamic pituitary adrenal input. But in cats with FIC, this does not occur. And then increased sympathetic input to the bladder is thought to cause neurogenic inflammation. So that leads to increased permeability of the urinary bladder mucosa, greater access of substances in the urine to sensory neurons in the bladder wall, increased pain receptors and fibers in the bladder, and the release of inflammatory cytokines from cells in the bladder wall and increased sensitivity of afferent nerves. Sensory input via afferent input from the bladder then is transmitted back to the brain and perceived as pain. That causes additional stress. So you can see that stress affects the bladder and the brain, right? So it is a vicious cycle. So with chronic stress, we then see that abnormal stress response, right? Cats with FIC have an abnormal stress response, which then allows increased sympathetic input to the urinary bladder. This causes bladder inflammation, right? Which we just talked about, and chronic pain. That chronic pain leads to more stress. So this vicious cycle, we have a cat that really is not feeling well. The key to breaking this painful cycle of stress is a multimodal approach. And we've talked about a little bit, right? We've talked about behavioral therapy, but stress management as a whole. Yes, behavioral therapy has, or environmental enrichment plays a huge role. Nutritional management, my particular favorite, right? For every cat, and pain management. So pain management, yes, we as veterinary nurses, veterinary technicians are going to do a pain assessment. In conjunction with our veterinarians are going to then diagnose and prescribe management to help with that stress. So we want to utilize these therapies and these management tools to help manage this cat's stress and get that cat back to living that human-animal bond, right? And so our goal for our multimodal approach, remember, is fewer painful days. That is going to result in a happier cat, a happier home and family, and we as veterinary healthcare team members will be happier. So one of the first nutrients that I want to talk to you about is an ingredient derived from milk. We know that milk contains a natural peptide or protein called alpha S1 casein. It's converted to a bioactive peptide, hydrolyzed casein, via hydrolysis with trypsin. Hydrolyzed casein is also known as milk protein hydrolysate or alpha-casozepine. It has a natural affinity for the benzodiazepine site of the GABA receptor and has been shown to regulate anxious and stressful behavior. So how amazing is that? That alpha-casozepine, right? Which is, derived from milk. It's broken down and it plays a huge role, has a huge effect on mood and anxiety in our cats. So we know that alpha-casozepine decreases anxiety in a number of species, right? Decreases anxiety and decreases stress-induced sleep disturbance in rats. Decreases stress-related symptoms in humans. So remember that, in quotes, old wives' tale, that, oh, if you drink milk before you go to bed, it will help you sleep. Well, now we can see where that came from and that there may be a little truth to that, right? Decreases stress and improved training in feral ponies. And so what effects have been reported in cats? Well, a randomized double-blinded controlled clinical study evaluated the effects of casein hydrolysate compared with placebo administered for 56 days to cats with confirmed anxiety or social phobias. Alpha-casozepine was associated with a significant decrease in fearfulness and increased contact with people. So remember those anxiety triggers, right? Fearfulness, nervousness, avoiding people. Well, alpha-casozepine has been shown to decrease fearfulness and increase contact with people in cats. So this is why I get excited about nutrition, because here we have one nutrient that we're talking about. So let's take a look at another. So another nutritional supplement is L-tryptophan, an essential amino acid found in many animal and vegetable proteins. it's converted to 5-hydroxytryptophan and then to serotonin. Again, this is why I get excited, because nutrition can help manage so many disease conditions. But look at what we're talking about with FIC. So dietary L-tryptophan has been associated with beneficial effects in several species. Improved coping ability and improved mood in stress-vulnerable people. Decreased territorial aggression in dogs, and decreased owner-reported anxiety in dogs. So owners actually saw a decrease in anxiety in their own dogs. And so what about with cats? Well, after L-tryptophan supplementation, all of the stereotypes or the triggers that we have been talking about, and some of the fighting behavior amongst cats in multi-cat households decreased. And so what we see is less anxiety and stress-related behaviors, again, with L-tryptophan. And isn't that what we are talking about? Trying to get, I mean, this image is not mine, but I love this image because of how comfortable, how relaxed do these cats look, right? Yes, they have their environmental enrichment, they have their cat tree, their cat condo, and they are just so mellow. So again, another nutrient. Okay, so what about cranberry? Because I have had that question come up, so does cranberry help with FIC or and FLUTD as a whole? And so, made with American cranberry extract, enriched in type A proanthocyanidins or PACs, right? And antioxidants. So yes, if we have that, but it's due to a patented extraction process, because what we're trying to do is eliminate unwanted sugars, and again, oxalic acid, and retain the desirable cranberry components. And so cranberry proanthocyanidins contain A-type linkages and have been associated with preventing adhesion of P-fimbriated uropathogenic E. coli to uroepithelial cells. So cranberry A-type bonds, or those PACs, have been implicated in uropathogenic E. coli bacterial anti-adhesion. So they can't dock. The bacteria are unable to dock. And then that helps in preventing urinary tract infections, while other PACs, so B-type PACs, have not. So it's these type A PACs that we are talking about. And then obviously we've already talked about antioxidants. So again, along with type A PACs, antioxidants will also assist in combating urinary tract infections. And really the biggest thing I want us to take away is when owners come in and ask about cranberry juice, there's a difference between cranberry extract with PACs and cranberry juice, which is usually cranberry cocktail, right? That does not, or cranberry cocktail typically doesn't have PACs. Unless it is absolutely true juice, there is no benefit. And true juice is bitter, and cats and really people may not like it. I know that cranberry juice, true cranberry juice, can be taken in by humans, but it is bitter. Cats aren't going to just drink it. And this is true again for both cats and people. So the the difference, oh, this is the same slide. I'm a doofus. So sorry about that, everyone. I have two of the same slides. It's an important point, so I really wanted to to make that point stick. Okay, and I talked about pain management as well. So we've talked now about environmental enrichment. We've talked about specific nutrients, nutrition in general for FLUTD patients, but specific nutrients to help manage stress in cats. And what about pain management, right? Because obviously this is a huge part of it. And veterinary technicians should be doing a pain evaluation on every patient, as well as a nutritional evaluation on every patient. So pain medications, yes, that will be in the bailiwick of our veterinarians. One thing I wanted to talk to you about is the assisi loop. This also helps to manage pain. And what this is targeted pulse electromagnetic field therapy. And it comes in a portable, easy to use device. And so what's going on here is it's delivering a signal that is tuned specifically to either minimize pain and accelerate healing, or to reduce canine separation anxiety, and to reduce feline anxiety, and help with that inflammation that we now know is occurring between the feline bladder and the brain. It really does stimulate the body's own natural anti-inflammatory process while speeding the healing of soft tissues. And so again, it helps to reduce pain, accelerate healing, reduces that inflammation. And it's compatible with other treatments for pain and inflammation. It may also help decrease the amount of pain medication, and it's portable. So we know that the human-animal bond is somewhat stretched, right, during a FLUTD feline lower urinary tract disease case, or especially with a feline idiopathic cystitis patient. We also know that our owners, want to help. Yes, they can help with nutrition because we as a veterinary healthcare team will make that, recommendation, but we can also make the recommendation for this pulse electromagnetic field therapy device that is portable and the owner can administer at home. Typically 2 15-minute sessions a day will help to reduce pain, accelerate that healing, and again, decrease the amount of swelling and inflammation. So we know that pain is a key clinical sign, and this can be done at home. And again, this helps decrease stress in our feline patients, both the device itself, as well as being able to administer this pain management at home. So we know all too well that inappropriate elimination is a common reason why cats are relinquished to shelters. But we want to make sure that this doesn't happen. Our goal is fewer painful days. For the family, yes. For the veterinary healthcare team, yes. But most importantly, for that cat. And so the key to breaking the painful cycle of stress in cats with FIC is that multimodal approach. We talked about a number of modalities, right? We know that stress management includes behavioral therapy, which we know to be, or which we discussed as environmental enrichment. Everything from feeding puzzles to cat condos to litter box maintenance, to food and water bowls, nutritional management for every cat, pain management, especially during acute episodes, and the specific nutrients that we discussed to help decrease stress in our FIC cats. So thank you guys for sticking with me. I'm sorry, between my eye and my cold, I had to pause, but you guys have been phenomenal and supporting me. So thank you so much. Thank you also to our sponsor, Viticus Group, Western Veterinary Conference, their annual conference, which this in 2025 is March 2nd through the 5th. And again, the URL for us to visit. They have some phenomenal feline continuing education, so please check it out. Thank you all for supporting Every Cat, our health foundation, where the future of feline medicine starts here. Truly, 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 research saves lives. So, so please check this out. There's a QR code, which obviously I didn't make. I can barely make my slides. But please check it out. Every Cat Health Foundation is doing some phenomenal things, and that's all attributable to you. So thank you.
Thank you. Yeah, thank you everybody for attending and for donating. Just as a note, in 2024 we hit a milestone and we funded $1.1 million this year in research projects. So
that is amazing.
Isn't that amazing?
Yeah. And I love the hearts and the applause.
I know, aren't those great? Okay. But before we go away, I've got a couple of questions. I got some good questions here. Can you stick around and answer a few, Kara? I know you're.
Yes. Yep. And again, I apologize for my voice.
You all sicko, you.
I know. I'm sorry.
Okay, so there's a couple of like really interesting questions. So a request from new parents, new human baby parents, about relinquishing their cat because the cat's peeing on the baby's things. Now, obviously, they know this is stress, environmental stress. What's the what would you recommend for those parents rather than relinquishing the cat to relieve the stress of this new baby?
That is a phenomenal question. So thank you. And you know, and that's a tough one because our our cat owners love their cats and they have families and they love their families and the cats are part of that. So first and foremost, I would have the cat checked out by the veterinary healthcare team to rule out any any disease processes that are going on. We've talked about some stress relieving things that management that can help. There are further management, which I don't get into because there are medications. You heard in my bio that I started as a human psychologist. Some of those same psychiatric or emotional medications can be used in our veterinary patients. Now, I'm not going to, nor can I, make that recommendation. But this is just to let you know that there are other medications out there that may help after we rule out, the disease process. There are we have veterinary behaviorists as well who can aid with, inappropriate elimination. After we have the veterinary healthcare team, the veterinarian diagnose or let us know what's going on with that patient, then we can start to implement some of the things that we talked about, the different environmental enrichment, especially providing more, maybe I know it's a human baby, but maybe some more safe spots for the cat. I know there are no physical risks to the cat, but the cat obviously is fearful or anxious about the new human. And so, we have to look at other behavioral management that can help. So, maybe some other environmental enrichment. So more cat condos, more cat trees, which are providing places to hide. We don't want the cat to be relinquished. There are further things in addition to nutrition or specific nutrients that the veterinary hospital and the veterinarian can offer to you. I'm not a veterinarian, so I'm not going to talk about medications other than there are other things out there to help. If I hope that made sense. Basically, I don't want you to give up hope, or I don't want the owner to give up hope until everything has been all management opportunities have been exhausted. There are further ones than what we discussed today is the point I'm trying to make.
All right, great answer. Good question too.
Yes, great question.
What is the most efficient way to reduce stress in your experience? Reducing external stress factors or reducing internal stress factors by feeding a high moisture, high quality diet?
Both. And I know that's probably not a fair answer, but asking a nutrition technician, I'm always going to go with nutrition first. But I've seen both. The biggest takeaway for me in working with cats and owning cats is both of those things together. And for me, environmental enrichment and nutrition are huge. Um, People, not anyone here, but I've heard people scoff before, like, oh, a cat tree is going to make a difference. Yes, it really does. Um, um, Changing the bowl, changing how the water is, given to a cat really has a huge impact on that cat's stress. It's hard to, some of the external factors, it's hard, if there are outside animals or, maybe the neighbor's cat goes inside and outside. Um, and it's hard for, to really control or to manage that. But there are ways to keep that cat happy and less stressed by the things that we talked about today. So for me, environmental enrichment, the right nutrients and getting water into them is huge. So I say both.
So, Chair, would you recommend more than one option for water, like a fountain and a bowl? Or, I mean,
Yes. Yep, absolutely.
because today they might be feeling the fountain and tomorrow not so much.
Right. Yeah. Cats, and you're exactly right, Virginia. Cats change their minds, more than we do. So yeah. I know that my Persian Ollie, he loves fountains, but and again, a lot of it has to do with whiskers too. His whiskers all go forward, kind of like a triceratops. Um, and and so he would rather drink out of a fountain, whereas the other cat, O'Malley, would rather use his paws and drink out of a wider, shallower dish or bowl. So having different kinds, and yes, each cat, also can, their tastes change from day to day, minute to minute. I've also had cats that will only drink out of the water faucet.
Yep.
So, just offering all sorts of different things is only in the best interest of the cat. It doesn't hurt anything. It's only in the best interest of the cat.
A question about kibble versus wet food.
Yep.
Um, Wet food is, yes, no, better for increasing moisture. Yes, no?
Yes. Yes. So canned formulas are better for getting moisture into the cat. Now, if we're talking specifically about feline lower urinary tract disease, studies also show that specific therapeutic kibble diets help to manage um, lower urinary tract disease as well. But overall, if we are trying to get moisture, increased moisture into the cat, then yes, a canned formulation. And the canned formulation even more so than adding water to a dry. Now, you can do that. That will increase the moisture, but the number one is giving a canned food. And by canned, it used to be just, the loaf that looked like the can when it came out. There are so
Yeah.
many, those still exist, but there's also stews and all sorts of different canned, in quotes, formulations. So that's what I mean when I'm saying canned.
And then also speak to their veterinary team about making sure that they're meeting the calorie content if they're switching over.
Oh, absolutely. I'm hoping that the veterinary healthcare team is calculating out exactly how much the cat should be eating. And then, we can go from there. We can still use canned formulations in feeding puzzles. So don't let anyone tell you that we can't. Might be a different type of feeding puzzle, kind of like the muffin tin or the ice cube tray, but we still can provide environmental enrichment through feeding puzzles with a canned formula.
Great point. Great point. This is interesting. Do you recommend that an owner buy their own CZ loop?
By their own what?
Do you recommend an owner having their own CZ loop?
Oh, yes. Yeah, absolutely. The sissy loop helps with so many different disease conditions, because again, it's accelerating healing, it's working on those soft tissues and decreasing inflammation that yes, I most certainly would. A sissy belongs to Zomedica, so you can go to the Zomedica website and I've consulted with them. I don't work for them. Um, so, I don't get anything. That's not why I'm saying it. I just have used that product. So yes, I would highly encourage that. And go and take a look at it. But it does help with FIC. It helps with osteoarthritis. So many different disease conditions. But, for us as owners, we want to help manage, we want to play a part in management of our cat's disease condition. And the Assisi Loop is a great way to do that.
What's a good source of the alpha cap? Kate,
Alpha casozepine?
yes, since milk isn't generally recommended for cats.
Correct. Yeah. So I would not give milk. Remember, this was synthesized. It's a derivative. So it has been synthesized out of the milk, for lack of a better way of saying it. You can purchase it, but what I have found is many of the pet food manufacturers are now including alpha casozepine and L-tryptophan in their feline stress formulation. So for those disease conditions that have a stress component, obviously FIC, you can already it's already incorporated into um, the food.
Excellent. And that kind of leads us into the next question. How do you select supplements that are high quality? There's so many on the market, and is there a way to narrow down which supplement?
Yes. When I'm talking veterinary supplements, I want to use our industry partners or our profession partners. Those, what I mean by that is those supplements that are manufactured for cats and dogs. They've been utilized or they've been given to cats and dogs um, as part of the research into making sure cats and dogs can tolerate that versus humans. So yes, I am going to look for the um, National Association of Supplement Council, NASC. I can't remember the letters, but that has a third party that does a lot of the testing, if you will. And I'm going to ensure that it's from, for example, Nutramax, Nordic Naturals. They are veterinary companies that produce veterinary supplements. So I know, and I will ask for the research, but I know then that that has been formulated for cats and dogs versus humans. The hard part is going to a GNC or an over-the-counter pharmacy. It's tough because studies show that what is on the bottle isn't always what's in the bottle. So that's why I say I utilize the products from our veterinary supplement partners. And there's a number of them. So I encourage you to, look them up. Again, just a couple off the top of my head are Nordic Naturals and the Nutramax company. And you'll see when you look at their website and then talk to them that it is for veterinary patients. So for cats, for dogs, and then for other species as well.
And always, it's a good idea to do some research.
Oh, yes. Always do your research and then bring what you find into the veterinary healthcare team and talk to them about it. Because there's a lot of, as everyone knows, there's a lot of misinformation on the internet as well. And we just, I always want to talk to you about what you've found in your research. Most often you're going to be absolutely correct, but I just don't want any harm to come to your pet if there was maybe not so forthright website out there.
Not that there aren't
No.
hundreds of those too. So a comment that somebody made, I have found D-mannose helpful in managing my cat's symptoms.
Okay.
Just an interesting one. And then another comment, I hope you heal well from eye surgery. Honored to hear you talk, even if we can't see.
Oh, thank you. That was so kind.
I just, yeah, I'm, yeah, I'm always honored to hear Kara speak just because I learned so much. And I just, yeah, thank you, thank you, thank you, thank you, Kara. So, for everybody else, if you're looking for race credits, please email webinars@everycat.org with your full name, your veterinary license number, and the state of issue. And I will get that sent off to you probably within a couple of days. Now, we have recorded this, and so it will be up on our YouTube channel in probably, hopefully, well, I'm going to say 3 to 5 days. But keep an eye out for it, and I will send an email out to let everybody know when it is available if you want to go back and review it. All right, Kara, anything you want to say in the end here?
Again, just thank you to everyone for coming, thank you to every cat for having me. Thank you to
Well,
WVC Viticus.
we kind of
And
have to have you now because you're the president.
you don't have to have me. You can say no. And I apologize again for my health right now, but thank you truly for sticking with me through it.
Thank you, everybody, who attended. Somebody else, one last quick question here. Besides Dr. Buffington, any other researchers who focus on FIC that you think of right off?
Oh yeah. Dr. Jody Lulich, Dr. Jody Westrup,
By the way, Dr. Lulich was here for a little while.
Good thing I didn't know that.
I know.
Yeah, there's so many. If you go to the Feline Veterinary Medical Association, there are a number of really outstanding feline practitioners that focus on lower urinary tract health. Dr. Susan Little. Oh, geez, there's so many.
It is. Trying to think of who else. Dr. Little. God, no, I'm not thinking. One thing that I find is helpful if I find a paper by Dr. Buffington, most papers usually have their references, and sometimes you can get names of other people that have done similar research from those references too.
Yeah, Dr. Jackie Nielsen did a lot of the behavior research in cats, like when I was referring to the clumping litter and the scented litter. And she's a veterinary behaviorist. Dr. Kelly St. Denis,
Yeah.
Dr. Quimby. I mean,
Yeah.
yeah.
Oh,
And
yeah. Because urinary and kidney is such a big topic in cats. I think there's a lot of people
yeah.
doing it. But start with Buffington.
Yes. Yep.
All right. Kara, again, thank you.
Thank you,
Thank you to
Virginia.
everyone who attended. And hey, Kara, go feel better, okay?
Yeah. Thank you,
All right.
everyone, so
Thank you,
much.
everyone.